I've left off here talking about this slide, just kind of an overview of the immune system. This is a really good figure, figure 22.2, in which it breaks down, all right, the two parts of our immune system, your innate and your adaptive, okay? And then today, we're pretty much going to go through all of the innate. I'll try to get into the adaptive a little bit, but as we move through this, you're going to be surprised just how much that you know, especially when it comes to the innate part, when we talk about the skin and the mucosal membranes, all right? Because if you think about the skin is considered, and the mucosal membranes, which line the opening and exits to your body, that's the first line of defense, all right? So it plays defense. It's all about prevention, all right? Like prevention defense, kind of, you know, if you follow sports at all, like football. And then the other part here, all right, when we talk about the innate, is the non-specific internal defenses. So what happens if something is able to get past, all right, the skin or the mucosal membranes? So now what happens, all right? And so we're going to talk about all these different processes that occur, all right? We have some because when we're dealing with the innate immune system, it is a non-specific but immediate form of defense. Okay, so, but when we get to the adaptive, that is specific. Okay, that is going to be specific. It takes a little bit longer. Okay, you got to build up an immunity to something. Okay, so we're going to talk about all that fun stuff today. All right, so innate immunity. All right, I think I threw this slide up there last time. Oh, no, I didn't. Okay, so keep in mind, all right, in the beginning, this is the immunity that you're born with. It plays preventative defense, prevents things from entering in, and then if they do, all right, then it's going to make a somewhat aggressive attack, but non-specifically on whatever those substances or those pathogens, those harmful substances that have managed to make it past the first line of defense. So that's why we say the first line of defense is the skin and the mucosal membrane. All right, and then our second line is going to be these internal processes that we're going to talk about. All right, we're going to talk about some of our leukocytes, all right, the macrophages and what they do, neutrophils, all right, basophils, mast cells, all these different types of cells that are going to be involved, all right, once that pathogen or whatever it is has penetrated through our first line of defense. And then we're going to throw some chemicals at it. Okay, we're going to talk about interferons, all right. We've actually synthesized drugs from interferons, okay? And then also complement. We don't really talk about the complement too much, but the complement is part of our immune system, all right, that is going to have several different options of how to get rid of pathogens, all right? It can attach an antibody antigen complex to the red blood cell and use the red blood cell as like a taxi cab, and it shoots it over to the spleen or the liver, and it gets peeled off there. All right, so we'll talk about all the different things, and then we're going to talk about inflammation and why fever is good, right? Because I do believe that fever is good. Low grade fever, 100, 101, okay, 103, sorry, 106, bad, 109, pretty much dead or soon to be dead. Okay. All right. So let's jump right into the first part, prevention. Okay, one of my undergrad, and when I was an undergrad, my degree I was studying was health and physical education. So I had to take a football class, how to teach football. So I learned about prevention defense. Okay, so that's what we're dealing here with. All right, and you learned back in chapter 6 when we talked about the integument, all right, how it is literally a physical barrier. All right, the outer portion of the integument, the epidermis, all right, remember when you have those 5 layers or 4 layers if you're in thin skin, all right, the stratum basale has, all right, the 3 different cell types, but the one I'm going to focus on are the keratinocytes. They divide in that cell layer, and then they move into the second cell layer, the stratum spinosum. That's where these cells start to create what we call tight junctions. They form close relationships with one another. And they're so close, they're going to prevent things from entering into the skin. All right, so we see that quite a bit in the epidermis. In the derm, and also in the epidermis, I shouldn't forget about the Langerhans cells. All right, those are dendritic cells. Okay, and they are phagocytic cells, but also what we call APCs, antigen-presenting cells. So you have immune cells in the outer layer of your skin, in the epidermis there. So if something does make it that far inwards, then it's met, hopefully, by one of your cells for internal defenses there, okay? So the skin is awesome because it produces, and we briefly talked about it in 210, all right? It will produce these first three, or actually all four of these are antibacterial substances. We know sebum. What produces sebum? Remember which gland? Sebaceous gland, yeah. And it dumps it right onto the hair, okay? And then, you know, if you've ever laid on something and you get off of there's paper there and it looks oily, guess what? That's your sebum, okay? Amongst other things, but that's mainly sebum, which is an antimicrobial agent, all right, that will kill, all right, bacteria and other microbes, all right, in addition to the dermacidin, the lysozyme, which is an enzyme there, and then defensins. Again, these are all antimicrobials. All right, so they help to keep, all right, the bacterial population on your skin in check. Now, you know, you may not know, but you have bacteria in your gut, all right, in the intestines there, and that's what we call the normal flora, all right? So you have bacteria that live in your gut. Well, you also have some that live on your skin, and that is a non-pathogenic or normal flora, all right? These microorganisms will live there, okay? And they help to keep the virulent or the dangerous type of bacteria in check because they're both competing for resources, okay? So as long as the good bacteria, all right, or the microbes, as long as the good microbes are present there, they're going to keep the population of the bad microbes down because it's a competition of the resources that are there. Perfect example, a way to understand this is if you're taking antibiotics, and especially for women, if you take antibiotics, you increase your likelihood of yeast infections because you decrease that good bacteria in the vagina, and it allows and increases the possibility, it doesn't mean you will, but it increases the possibility, right, of a fungal infection, okay? Similar type of relationship here on your skin. Okay, so the mucous membranes, remember there's 4 membranes in the body. All right, there's serous membranes, which we talked briefly about in the beginning of our semester. Okay, cutaneous membrane, which is the skin, synovial membranes that we saw in the joints, and then our fourth are the mucous membranes. Okay, and these are going to be found in the openings to our body. Okay, so nose, throat, mouth, all right, anus, vagina. We'll see these mucous membranes in those regions there. All right, so yes, they produce mucus, all right, which will have these antimicrobial substances, again, defenses, lysozyme, and then this guy right here, IgA. It's an antibody, an immunoglobulin, specifically. That's what the Ig stands for. Okay, so now you're seeing one of the first classes, all right, of your antibodies or immunoglobulins present in your mucous membrane. Okay, so if you inhale something, get something into your nose, in your nasal cavity, right? The mucous membranes there are producing these substances here to help to decrease, all right, I won't say deadly, but the dangerous microbes there, okay? So again, we will have that harmless bacteria in these areas too, and again, it has that relationship where it helps to suppress or decrease the growth of the potentially dangerous types of microbes. All right. In some cases, the book calls them virulent, and those are potentially dangerous. But if you take a microbiology course, they call them opportunistic. All right. You give them the opportunity, they're going to kick your butts. All right. So that's our first line of defense. That's our preventative defense. Now we're going to talk about you make it past the first line of defense, no problems. It's like playing football. You make it past the defensive line, you still have linebackers to contend with. All right. So now we're going to deal with we're dealing with non-specific because it's the innate immune system here. So it's a non-specific response. But we're going to talk about these types of cells. Phagocytic cells, the Pac-Man cells. They go around and they gobble things up. Okay, so you need to know this. The neutrophils, the macrophages, and the dendritic cells. These last two are also known as APCs. We'll get into detail about that, but I'll say it now. All right, those are antigen-presenting cells. Okay, so we're all familiar with phagocytosis, right? Okay, cell eats something up, and then it breaks it down, and then it excretes it, poops it out. Okay, that's what it does. That's what these cells will do. So notice, up here on the slide, it says unwanted substances. Doesn't necessarily have to be, all right, a virus, a bacteria, a microorganism. All right, unwanted substances could be damaged cell tissue. Okay, macrophages go on site. If you cut yourself and you damage some collagen fibers, they go in there and nibble on the collagen fibers. Get rid of the bad stuff. Okay, those are unwanted substances. So it gobbles them up and it ingests them. Okay, so our neutrophils and macrophages. All right, well, I'm going to run through this, but this whole process is going to repeat here when we get into later on in this chapter. So I'm going to just kind of give you a basic oversight. Okay. So these cells, the neutrophils and the macrophages, are going to essentially, you remember exocytosis, the pseudopods extend from the cell body itself and then form a vesicle and surround whatever it is that it wants. It forms a vesicle and it pulls the vesicle inside. Okay? So what it will do now is it has the vesicle inside the cell, and then it's going to combine it with a lysosome. Okay? Lysosomes are these membrane-bound organelles inside the cells. Remember, they have digestive enzymes. Or we talked about the important role of the lysosome in the formation of thyroid hormone. Remember, thyroglobulin and iodine, how that we need a lysosome to cleave off, all right, parts of the molecule so we can get our T3 and T4. Okay? So that lysosome will fuse with that vesicle, and we call that a phagolysosome. So now we have this phagolysosome that is going to be mixing up with the digestive enzymes from the lysosome, and it breaks it down. Okay? And then what will happen is the cell then will get rid of the debris. But the important thing is now, if we're dealing with a substance that is a pathogen, like a virus, right? Then you'll see what we undergo, what's called the respiratory burst. And the respiratory burst involves a molecule that has oxygen in it. Okay? Hydrogen peroxide is a perfect example of one of those molecules. Hydrogen peroxide is a great cleaning agent, and you can actually disinfect wounds with it. Well, guess what? Your cells make it. All right, so they're going to add, for example, not just hydrogen peroxide, but superoxide dismutase is another one. All right, these are powerful enzymes that contain oxygen. That's why when we say the respiratory burst, it has to be an oxygen-containing molecule. And it combines, all right, because that's what's present in the lysosome. When it combines with the phagolysosomes, it will literally destroy any of those microbes. All right? It's almost the equivalent, almost I say, to that of bleach. And we all know that bleach is the way to go if you want to kill stuff. All right? That's why I gargle with it frequently, because I want to make sure that my breath is fresh. I'm kidding. I would never do that. Unless Donald Trump told me to do it again. Oh, wait, he already did that. All right, anyways. All right, the only time that I throw some political humor in there. All right? So then after that occurs, we combined all that stuff, and then we got to get rid of it. Okay? So that's neutrophils and macrophages. Our dendritic cells, right? These guys here are cool. They're a little bit weird. It's like the weird friend that you might have, because what they're going to do is they're going to phagocytize something, and this is the one I was telling you about. Then they kill whatever it is, and then they put it on side. They wear it on its skin, on the plasma membrane. That's what it does. All right. So it destroys the particles, and then it presents the particles or the fragments on the plasma membrane. Because it's going to go find another cell, and it's going to show this other cell, mainly T lymphocytes, all right? It's going to show these particles, all right, to the T lymphocytes, and then it potentially could initiate the other type of immunity, the adaptive immunity. Okay? So dendritic cells are antigen-presenting cells. Macrophages will do it also. Okay? So those are both APCs. All right, so here's a quick picture of what I just said. Here's your dendritic cell. All right? Here is a phagocytic cell, a neutrophil macrophage or dendritic cell. The infectious agent or unwanted substance gets engulfed through exocytosis. It combines with the lysosome, forms the phagolysosome, undergoes the respiratory burst if it's a microbe or some sort of infectious agent. All right, and then it just pretty much degrades and breaks down whatever it is, and then it shoots out the leftover particles, which are usually just protein fragments or some sugar. Okay, so that's basically in a nutshell. We're going to go through this in a little bit more detail, all right, because on how that impacts the actual immune response. Does that seem pretty clear to you guys? All right. So a little bit of this is a review. Okay. So now we're going to, that's the non-specific cell response. All right. Now we're going to talk about, all right, that non-specific cell response that involves chemical secretion, which are going to be pro-inflammatory. Guess what? Inflammation is good. All right. Not a lot of it is bad. Okay. Short-term inflammation, good. Chronic inflammation, bad. Okay. So acute inflammation is part of the normal healing process and the immune response. So we like that. Chronic inflammation, all right, months, years, not good. Okay, if that's been going on, there's a problem. Okay, so let's talk about these two cell types. We've seen them before, the mast cells and the basophils. Let's pretend that they're the same cell, except where they live. Okay, they live in two different areas. The basophils are in the bloodstream. The mast cells are in tissue. Okay, connective tissue mainly, but we'll see it in mucosa, and so also the tissues of organs. Okay, so keep it that simple. Basophils, blood, easy to remember, B and B. All right, mast cells, tissue. Okay, so they both perform similar functions. They're both going to release chemicals. Okay, and these chemicals are going to promote an influx, or it's going to increase the movement of fluid. And where does fluid usually reside? In the blood. And it's going to encourage the movement of fluid from the blood into tissue, specifically damaged tissue. Okay? So it helps that we have the same type of cell, and I hate to say the same type of cell because I don't want you to compare them. They're not really the same. They're just very similar. It helps to have, all right, cells that do pretty much the same thing in the blood and in the tissue on both sides. Okay? It's like a double agent. Okay? So the chemicals that they release are what we call chemotaxic chemicals. And those are attractive chemicals, mainly to immune cells. That's a chemical signature. So these cells will release these chemicals into the area that we need to have inflammation occur in if it's damaged tissue. And that will attract other cells to come there. Macrophages, because remember, if it's, let's pretend it's a skin injury. You got a cut. Okay, and there's an example here later on that I'll show you. All right, you scrape your knee, you're bleeding. All right, you've cut the skin. Well, we've got to repair that tissue. Well, macrophages need to get there. All right, but they need a little bit of help of where to go. So we release these chemotaxic agents. Neutrophils, they're going to get there in case some sort of infectious agent gets into there. All right, fibroblasts. All right, so there's going to be several different types of cells that are going to migrate to that area. Well, both of these cells release these two chemicals here. Histamine, we're all familiar with both of these because we talked about it, all right, when we talked about the cells of the circulatory system. Histamine creates vasodilation. What does that mean? It makes a capillary leaky, all right? Because remember, our goal is to get fluid that's in the capillary in the bloodstream out to the tissue. So let's make it leaky, all right? And then heparin prevents that blood from clotting because we can't have it clot. If cells are trying to migrate to the area, all right, That's like me closing all these doors and locking the doors, and there's half the class trying to get in. I'm like, come on in, and they can't get in. All right? I don't want that area to clot. So I want to keep blood flowing so we can get the migration of more cells there so they can travel through our leaky blood vessels out to the damaged tissue. So we want heparin to cause an anticoagulation phenomenon, and the histamine makes our capillaries leaky. And then, in addition to all this, these cells will produce, remember these guys, the eicosanoids, the locally acting hormones. All right, remember prostaglandins, leukotrienes, all those fun chemicals that we were talking about, prostacyclins, all those. All right, well, these guys are going to release these eicosanoids, which will help to increase more inflammation. Okay, so you can kind of see how these cells are important, all right, in attracting and how their chemical release is going to affect those tissues there. So you can see here, here's our basophil with its histamine, heparin, and eicosanoids. All right, and it's actually going to be releasing, I mean, they're supposed to be inside the capillaries, the blood vessels, and it's going to be releasing, all right, its chemicals in this vascular bed, all right, causing vasodilation, so more blood flow can occur. The heparin will decrease the chance of clotting, and then the eicosanoids are going to increase inflammation and increase cell signaling so we can get more cells to migrate to the area of injury. All right, so that's the chemical attractiveness. How about the cells whose job it is just to kill things? So it's a perfect name for this cell, natural killer cell. That's what it does. It kills things. All right, so apoptosis is cell death. That's what it means, cell death, kill, kill, kill. Okay, so these types of cells, the natural killer cells, they're really cool. All right, are going to destroy any type of infected cell, damaged cell, cell that really doesn't serve a purpose anymore. Think of them as constantly floating through your body, monitoring and checking on things. Because if it sees any type of weakness in a cell or abnormality, it's going to kill it. It's not even going to wait. It's not like, hey, you know, these are the cell that goes around, show me your papers. Oh, you don't have your papers? You're dead. I'm going to kill you. All right? So, like our other leukocytes, they're formed in the bone marrow here. All right? Then they circulate throughout the blood, but they spend a lot of time, if they're not on patrol, quote unquote, all right, in the secondary lymphatic structures. What are those? Lymph nodes, spleen, all right? And we'll talk about some of the secondary lymphatic structures more in lab, okay? So think of them as surveilling the body, just rolling around, checking stuff out, making sure that cells that are there are supposed to be there. So what do they hate? They hate virus, bacteria, infected cells, cancerous or tumor-infected cells, or, unfortunately, transplanted tissue. So it's great for the other ones, not so much for transplanted tissue. But again, transplanted tissue is not your tissue. All right? It didn't come from you. It's what's considered non-self or foreign. So unfortunately, when you have a tissue transplant, lung transplant, kidney transplant, we have to give you drugs that are going to suppress the activity of these cells. So you are going to be immunocompromised in certain regards, all right? But it's better to be immunocompromised than to be dead, all right? Because maybe you needed that transplanted tissue to sustain your life, okay? So these guys are cool because what they do is, when I was a freshman in college, I had to take Army ROTC. And we had a gentleman, now I'm dating myself when I say this, so this was back in 1992. And I'm sure many of you, if not all of you, probably were not born by then. All right, so this is the year that you were born. Well, which is funny because this kind of applies not to you, but you will see, you get, I won't say a kick out of this story. But my ROTC teacher, he was an Army Ranger from the 10th Mountain Division, which is up in New York. He was down there. He'd just gotten back from Iraq. And so he was explaining to us military tactics. And so he showed us a video in which they were going to breach a building. And so this one member of one of his platoons it's called an M203, which is a grenade launcher that's attached onto the assault weapon. And he shot it into the wall of the building, exploded the wall. A couple of enemy combatants rolled out. They took care of them. But then all of a sudden, all these, and this was videotaped. Wasn't the best quality. It wasn't movie Hollywood, quality. But then you could see all these soldiers move into the hole that they had blown into the wall of this building and to engage in the enemy combatants. That's what the natural killer cell reminds me of, because it produces this one chemical called perforin. All right, and what it does is it makes holes or pores in the cell that it's decided to destroy. And by doing so, then it pumps in what we call granzymes into the pore, and it causes cell death. And it doesn't cause it by cell lysis, what you would think, where you put holes into the cell and it would fill up and explode. It actually shrivels up. All right, so it kind of does the opposite of what you would think. All right, so it causes a shriveling phenomenon. So let me show you a nice picture here. Here is your natural killer cell. All right, and here's the unwanted or unhealthy cell. So it first releases these perforins, all right, and they form these pores or these holes, so the granzymes can get in and just destroy the internal part of that cell. That's what reminded me when I watched that video. Well, I didn't know any of this information at the time, but when I was, reading this or thinking about it, that video somehow surfaced in my brain. I just draw strange conclusions about certain things. But you can see how we have this hole now. Now the granzymes can get in and then destroy the internal organelles, the nucleus, and cause the cell to undergo apoptosis. Okay, so that's what they do. And so again, some of it could be specific if it's related to the acquired immune system, but when we're dealing with innate immune system, if the cells, these unwanted or unhealthy cells, do not have the right, I joke around and say papers, but the right membrane markers, okay? If it doesn't have the right membrane markers, or if it's foreign, it'll kill it. It'll kill it. No questions asked. All right, so we all have allergies. Well, I won't say we all, but a lot of us do, okay? And so we have a cell that's specifically designed to help engage with allergies, the eosinophils here. But their role, again, it's another blood circulating cell, all right, a granulocyte, all right, that will release its granules in response to certain types of infection. So if you're looking at somebody's CBC with diff, and you look at it and you're like, oh, this person has an elevated number of eosinophils. You're thinking two things, all right? And usually the history will help you. Either they have a parasitic infection of some sort, and then you can determine that if they've had any out-of-country travel. Maybe they went to South America or over to Africa, or I'm trying to think any other place that usually has pretty heavily rainforest populations. Usually, or even some of the foreign islands, all right, Caribbean islands, so to speak. All right, you're either thinking it's a parasitic infection, or you're thinking allergy, some sort of allergy-related condition. And that's what we see here, okay? When we're talking about our eosinophils, right? They will attack what we call multicellular parasites, usually, like microscopic worms, okay? And they have a very similar type of attack, all right? Their enzymes that they release are going to literally punch holes, what we call transmembrane pores, into the cells of these parasites, okay? And then that will actually kill these parasites. Look at this picture here. This is supposed to be just a small example. Parasitic worms are one of the larger microbes that can invade, all right? And so you have these little cells here, all right, these little eosinophils that release these chemicals that will just punch holes all throughout, all right, the membrane of that microbe there, okay? And so also, when we see elevated numbers of eosinophils, you are thinking allergy, and asthma is an allergic, I shouldn't say it's just an allergic reaction, but a lot of allergy causes are an allergic reaction to something, okay? And then also we'll see antigen-antibody complexes. We'll talk more about that, but that's when the antibodies, which are produced by the plasma cells, engage antigens and they connect together. All right, and while they're floating around, all right, the eosinophil, when it's passing through, if it sees, all right, an antigen-antibody complex, it just eats it up, takes care of it. Okay. All right. Questions so far? Am I going too fast? I gotta take a sip. Give you a chance to take a quick note here. Okay. All right. So let's move on and talk about more chemicals here. All right, you heard me mention interferon, okay, and what that is. All right, so we saw that certain cells will release chemicals onto whatever it is, an unwanted cell or a microbe, parasite, whatever, and then those chemicals will help destroy whatever it is that they're trying to get rid of. All right, so now we're going to talk about a classification of chemicals, right, which we call interferons, which are just cytokines, and cytokines are just cell-produced chemicals, right, that are going to perform different functions, right, depending on what they're specific for, okay? So the three that you need to know are interferon alpha, interferon beta, and interferon gamma, or gamma interferon, alpha interferon, or beta interferon, okay? These are the three that you need to know for this chapter. The first two, all right, are going to be released by either leukocytes or a cell that's been infected by a virus. Okay, it's like a distress signal. So the cell gets infected by this virus and it shoots up a flare. All right, and that's it's alpha interferon and beta interferon. All right, so what that does is it sends up this flare. Okay, so if the flare is shot up at night, you can usually tell where that person is. So the cells that are close by, the neighboring cells, all right, what they will do from the alpha interferon and the beta interferon is they're going to take preventative measures, all right, to help prepare themselves in the likelihood that that same virus, all right, tries to infiltrate that cell. All right, it's like a burglar. All right, you know the burglar's next door. All right, first things first, before you want to go over there and handle the burglar, you got to make sure that your house is secure so the burglar doesn't break into your house. All right, so that's what we're doing here. So the neighboring cells are going to try to prevent the infection of the virus that is affecting one of its close neighbors there. So it's going to take precautions and it's going to start to create enzymes, all right, that are going to kill the nucleic acids, which is the genetic makeup of that virus, because that's what viruses do. They infiltrate a cell, and then they turn that cell into a factory to make more of that virus. All right, so it will actually get that cell to make more proteins, more nucleic acids, all right, so it can make more virins. All right, at the same time, all right, it's going to prevent the creation or synthesis of viral proteins. So it's shutting down the factory before it ever gets set up. All right, so therefore, that neighboring cell that has the alpha and beta interferons is safe, somewhat. Okay, now it's not always 100%. Okay. Also, this alpha and beta interferons will then, hey, there's my boy, the natural killer cell. It's going to trigger the natural killer cell to go in and kill that virus-infected cell. Again, it shot up the flare. The neighboring cells are like, oh crap, let's start, making enzymes and preventing the synthesis of any type of viral proteins, all right, in case that virus tries to infect us, which likely it will. It'll try to infect, so it mounts a defense. And then that flare that went up, all right, natural killer cells that could be in the area, because remember, they're always on patrol, they're always surveilling, sees it, it's like, okay, I'm heading over there, something's going on over there, let me take care of business. Okay? All right, so that's what we're going to see in this first part here. I'm going to come right back to that previous slide. Here's our infected cell. Here it sends up the flare. okay? The alpha and beta interferon, all right, is going to then stimulate the neighboring cells here to make things that will prevent them from getting infected. Cool, we like that. At the same time, all right, that flare, all right, the alpha and beta interferon is going to stimulate the natural killer cell, all right, to migrate to the area to do the following. It is going to either cause that natural killer cell to directly kill the infected cell, all right, or it will then, the natural killer cell will produce gamma interferon, which will then stimulate the macrophage, which cracks me up, all right? So why couldn't the natural killer cell just go after it? You know, and now it's got to release gamma interferon, and then it goes and gets the macrophage to do dirty work. I really feel like the macrophage is like the whipping boy of the immune system. It's underappreciated, and I'm trying to create an appreciation. You know, maybe make a t-shirt or something. Anyways, so the gamma interferon, all right, you can see here it comes. It rolls in. The natural killer cell rolls in. It can release its gamma interferon onto the macrophage, which will then kill the infected cell, or the natural killer cell can do its thing, which, what is it? Releases the perforin, releases the granzymes, punches holes into the infected cell, all right, and it undergoes apoptosis. So there's a lot that can go on here. Now remember, this is not just like one cell, like one-on-one, unless it's very early. That's rare, and I'm almost going to say it's an impossibility. This is thousands, all right, possibly even millions of cells that are getting involved in this. Okay, so it has to be on a larger, grander scheme. Okay. All right. So that leads me to the next part, the complement system. Okay. The complement system involves, all right, a set of proteins that we call complement. And so we don't get really too creative when we name these proteins. We assign them with C and a number. That's it. Because basically the complement system is an enzymatic cascade. You've heard me say that before. Okay? We're going to start off at the beginning. It's going to undergo, all right, these chemical reactions that are going to move through a series of steps. Believe you me, it's a long process. It's not anywhere as cool as what I like to talk about, all right, and somewhat boring, so I'm not going to bother you with it. But what you need to understand is, all right, these proteins are made in the liver, and the liver, just like, all right, angiotensinogen, it pumps it out all the time in the inactive form. Remember, it's better to have it and not need it than to need it and not have it. So it's pumping them out all over the place, so it's in circulation here. Until we have something that's going to activate the complement system. And when that does, then we invoke our enzymatic cascade. So what is going to invoke the enzymatic cascade? What's the stimulus? We're going to have some sort of pathogen enter in. Okay? A bacteria is going to enter in. All right? When that happens, we're going to involve some sort of pathogen. There's two pathways that we can go down. Okay? You need to know the difference between the two. Okay? The classical, the first one listed here, all right, involves an antibody. Okay? The alternative pathway is going to involve either sugar, polysaccharide, right, which usually comes from some form, either a bacteria or a fungus. Okay? Those are what I need you to understand. Classical. All right, so we have the antibody attaching onto, it's listed here as the foreign substance, but antibodies attach onto antigens. All right, it's some sort of foreign substance, usually an antigen. What's an antigen? It's either a foreign protein or a foreign sugar, a polysaccharide. Okay? So the classical involves the antibody, and the alternative, all right, is going to involve a sugar, the polysaccharide here. This is highly active in bacterial infections. And so there's 4 different processes that this complement pathway will undergo. Okay? I'm going to show you each. So what I'm going to do is I'm going to show you one. You know my thing. I'll show you one. I'm going to show you a picture of it. All right? So you go back and forth to gain a better understanding. All right? So the 4 effects are opsonization, inflammation, all right, cytolysis, all right, and then elimination of immune complexes. Okay? So the first one here, opsonization, all right, essentially what happens is the complement, all right, opsin, is going to bind onto that pathogen, all right, and what happens is that's like a label, it's like a tag. Okay, similar to how ubiquitin in the cell will jump onto a protein that was misshapen or an incomplete protein, all right? So the proteosomes can digest, all right, those proteins, all right? Well, we have our own tag here, all right? When we're talking about opsonization, opsin, I'll show you, will jump onto our pathogen right here, okay? And so that sends up a signal, all right, to a phagocytic cell or a macrophage here, and it comes along and it gobbles the whole thing up. And we know what happens after that, right? When it gobbles up, we know that whole process. Okay, we'll form a phagolysosome, respiratory burst, destroy this thing, and bang. Okay. The nice thing is, if it's a macrophage is an antigen-presenting cell, so it can destroy that pathogen, and then it can display it on its membrane, and then it can wander around to the other components of the immune system, and then it can actually then invoke the adaptive immunity. Okay? All right, so that's opsonization. Our second one is inflammation. Guess what? We're already familiar with inflammation. All right, so what happens? Basically, we're going to activate all the cells that are involved in inflammation. Mast cells, basophils, they're going to be activated and they're going to release their chemicals, which will attract neutrophils, macrophages. Okay? Here's the picture. So all we need to do is activate these cells here, the mast cells and the basophil, which will start the inflammatory process, and then the chemotaxic, all right, chemicals will then attract neutrophils and macrophages, these are phagocytic cells, to that area, okay? And will undergo the process of inflammation. That's the second effect. The third effect, which I really like, is it's got the Big Mac attack, all right? This one here, all right, cytolysis, is basically, all right, the complement is going to cover, all right, the pathogen, all right, or the bacterial organism, and it's going to punch holes in it, okay? So, except in this case, the cell will undergo lysis, okay? So it punches holes into the plasma membrane, and this cell will burst. So we just cover it all up. We pile on a whole bunch of complement onto this pathogen. It punches holes in it, and bam, that's what we're seeing here. So here's our complement floating around. It identifies a pathogen. It covers the pathogen, all right? And it creates these holes in it, and it causes the cell to burst. And that process, all right, is the membrane attack complex. It just creates channels, holes in the plasma membrane. And then our last one, the elimination of the immune complexes. This involves that antigen-antibody complex. Right? So you have the antigen, okay, that foreign sugar or protein. The antibody recognizes it, binds to it, and then what will happen is they'll just be floating around in the blood. Maybe a wandering phagocyte will engulf it, but if complement's nearby, the complement will attach onto it, and then that allows that complement to hook on, that whole complex to hook on to a red blood cell. And then, as you know, the red blood cells will circulate through all right, specific organs, all right, when it gets to the spleen, all right, or the liver, it strips off those complexes there. Well, guess what? In the spleen, all right, you have immune cells there. They'll take care of it. Okay? That's what we're seeing here. Okay, so here's your antibody. Here's the antigen. All right, now they're just floating around. The complement latches onto that, and it allows it to latch onto the erythrocyte, and it catches a ride. All right? The red blood cells have to circulate through the spleen and the liver. And they go one of those organs. These complexes get stripped off, all right, and then they're destroyed. Okay? So in case you're not kind of grasping, there's a lot of things that are going on in the immune system. This stuff is happening all of the time. All right? So it always kind of frustrates me when I hear in the news when they talk about how COVID-19, you know, how this virus or is able to be such a problem, because you're thinking, well, all this stuff is going on. Why can't we control that? And again, we're still in the beginning stages of trying to understand it. So there's a lot going on. All right. Some of it has to do with the antibodies that we're making just aren't able to attack the virus as efficiently yet, but they're always being modified. All right, it's like cars. We're always trying to make a better model. All right, to handle. All right, be safer, drive better. Well, that's what antibodies. They're constantly going. Read my article. I'm telling you, it'll blow your mind. Read it later though. JJ, yeah, Johnson & Johnson. Yeah. It's a one shot. It's 66.7% effective though. That's the drawback. But it's one shot though. But I've heard that it's supposed to be pretty decent in regards to the variants. It's supposed to be. I've heard different numbers. I've heard 94, 93, 95. It's been floating. I've heard 87 too for some of them. So, but there's more topics now in discussion about once you get the vaccine. This is promising about the transmissibility. Folks that get the vaccination are less likely to transmit the virus now. And I can't remember, I saw a couple numbers. I think 86.7 was for the Moderna, the transmissibility, which is good. So obviously the more people that get vaccinated, the less likely for transmissibility. So again, it's still in the beginning information phases.
Are they doing Moderna? I thought it was all Pfizer.
I haven't heard of anybody getting Moderna.
So the long-term care facilities are the ones that are getting Moderna. So like CVS's and Walgreens, those are the ones getting Moderna. Pretty much everywhere else. Because I got the Moderna when I worked at CVS.
Okay.
Huh.
AstraZeneca was another one, but
Yeah, I thought another one.
yeah, but I heard that South Africa said they weren't going to use it anymore. So I don't know. I have to do more research on it. There's so much stuff out there. I just get inundated. There's a lot to take in. Okay, so I want to jump into inflammation here and get into some of the details about it. Okay, it's actually a fascinating process in regards to certain things. And believe it or not, when we go through it, you're going to be like, oh, this makes sense because I already know this, because we've taught through the course up to this point just little snippets of it. Now we're going to put it all together so you can actually see what happens with inflammation. First of all, some of the characteristics. Inflammation is local. Okay? Now you've heard sometimes people say they have systemic inflammation. All right, that's a little bit different. But for right now, when I say it's a little bit different, it's usually because of some sort of systemic condition is going on. Okay, but for right now, for our purposes, we're going to talk about local inflammation, like if you sprained your ankle or if you've got a cut on your arm and it gets inflamed. That's what we're talking about here, okay? Again, it's also because it's part of the innate, it is non-specific, all right? And this is what happens when we have some sort of vascularized tissue injury. Okay? We have to involve blood vessels in this, okay? So, basic, in short order, here's what happens. We injure the tissue. These cells, all right, move into the area, all all right, and then they release their chemicals and they initiate the immune response, which brings in a whole bunch of other cells. Okay, that's basically what inflammation is. Okay, so the basophils, which are in the blood, come to the area. The mast cells are already there. They're on site because they live in the tissue. All right, they're going to release their chemicals, which are going to increase vasodilation, causing more blood to flow to the area, making our blood cells or capillaries more leaky, and they're going to prevent clotting so we can get more cells to migrate to that area. So we can send out more chemicals like, hey, the party's here, come here, come here. You ever seen those spotlights at night, you know, up in the sky? If there's an opening for a club or a bar or whatever, or if there's a red carpet for a movie, they always have the spotlight. That's where they're trying to draw people in, like, come here. That's what is happening here, okay? So they release these chemicals that are going to attract your immune cells to the area, okay? And so some of these chemicals, we already talked about histamine, makes our blood vessels leaky. Heparin prevents it from clotting, all right? The leukotrienes and the prostaglandins are going to draw other cells to the area, also increase the body temperature, increase the metabolic rate of the cells in that area as we try to repair the tissue, okay? So let's start off here in the beginning, okay? So what's the first thing we're going to do? We are going to affect the blood vessel here. Because remember, our blood vessel is our transit system. All right, that's how we get a lot of these immune cells, and not just the immune cells, all right, but other cells. Remember, there's more things than just cells that travel in the blood. Remember all the proteins that travel in the blood, like albumin, all right, immunoglobulins, what are those? All right, some of the immunoglobulins are antibodies, okay? So we need to get some of the proteins in that area too, okay? And we'll get to that in a second. So we get vasodilation, we make the blood vessel bigger, and as you know, if we increase the lumen of a blood vessel, we're going to increase flow because we decrease resistance. So blood flow, boom, we've increased that. The capillary becomes leaky, so the stuff that's in the blood can get into the tissue that's damaged. Now, this is new. Cell adhesion molecules, or CAMs, okay? See, blood is in constant motion. It doesn't just stop and start and stop and start like a train, okay? So blood is in constant motion, right? So if I get off the train, I would like the train to at least slow down before I had to jump off the train, okay? But in this situation, blood doesn't slow down. In fact, flow increases because we vasodilated the area. So now blood is really cruising through that area, all right? So we don't want the cells to overshoot the injury site. So guess what? It's like this. You're in the river paddling in your kayak, you fall out of your kayak, and you're getting washed down the river. And you're caught in the current. I'm standing on the riverbank like, hey, grab my hand, grab my hand. So I reach my hand out and you grab it and I pull you to shore, okay? I am the CAM. I am the cell adhesion molecule. I am reaching out, grabbing you, the cell, and I'm going to pull you to shore. In this case, all right, I am going to pull you, all right, to the area of injury, okay? So these CAMs, all right, actually will cause white blood cell or leukocyte adhesion to the cell wall. So it starts to slow the cell down as it's tumbling along the periphery of the vasculature there, okay? So we're going to talk about these three terms here: margination, one of my favorite words to say, diapedesis, and chemotaxis. Okay, so here's our blood vessel, okay? Here are our cells tumbling down, or actually, blood vessel. Here are our cells moving down, okay? We need to get them towards the periphery, okay? So we need them to go against the wall, the endothelium, all right? So that process of getting the cells to go against the wall of the endothelium, all right, is called margination. And basically, how do we do that? We get people to stand, all right, on the riverbank and extend their arms out, all right? Those arms are the CAMs, the cell adhesion molecules. So they grab onto your leukocytes, the white blood cells there, and they pull them and hold on to them against the vascular wall. Okay? Meanwhile, all right, that histamine has caused that vasodilation, but also made, all right, the vascular wall more leaky. So now we have these spaces in between the endothelium. So these cells undergo this process called diapedesis, in which they start to squeeze through. Because they're going to migrate. Remember, they got to get out into the tissue here. They're going to migrate from the blood vessel or the blood into the tissue. That process is called diapedesis. Okay? Now, on the other side of that blood vessel wall, the damaged tissue is releasing chemicals, shooting up the flare. All right? Those are chemotaxic chemicals attracting these cells to migrate to that area there. So it's really kind of cool. All right? So these chemicals that are being released, all right, from a couple different things. It can either be from the mast cells or some of the immune cells that are sitting there, all right, from the damaged or dying cells, all right, or if we get any pathogens like bacteria or viruses into that injured area, they'll release chemicals that will attract these immune cells to the area. So there's a lot of stuff happening here, okay? It's not just one thing happening, all right? So all these damaged cells, dead, dying cells, all right? Some of the white blood cells that are already there, all right, like our mast cells, and we also will have the pathogens that if they've actually made it into the wound, all right, that are all going to be sending out chemicals that are going to attract more white blood cells to the area. Okay, so these leukocytes then, all right, will release their own chemicals, the cytokines, all right, and that will then, well, it depends on which ones they're releasing, will act as chemotaxic agents, but also are going to stimulate, what's this process here? What is this? What's that? That's right, leukopoiesis, the formation of more white blood cells. So our red bone marrow, all right, our primary lymphatic structure is going to make more white blood cells. Cool. Now they're not going to be ready. It takes a while. All right, but hey, guess what? Unfortunately, it's like war. It's like a battle. We're going to lose some soldiers. All right, so we got to go recruit and have more soldiers. Okay, so we're going to have that going on. And then, of course, we got our wonderful, lovely, awesome macrophages. Right, they're going to be releasing some of their own cytokines, but one classification of a chemical that they're going to release is called a pyrogen. And that pyrogen, all right, is going to cause fever. And we'll talk about fever here shortly, okay? Because fever's good. I told you that before, right? All right, good so far? Okay, so now let's talk about the other stuff that's in the blood. Remember I said it's not just cells in the blood, okay? There's other stuff in there. Proteins, plasma proteins, okay? So just to name a few, we've got our immunoglobulins there. We talked about albumin and whatnot. Also, we've got our clotting factors. That's important because eventually we will want to clot this problem, all right? We've got our kinins, which are a classification of proteins that I'm going to talk about in a moment, but one such kinin is called bradykinin, and that helps to cause pain. Pain is good because, well, feeling it's not good, but it's actually good in regards to our to reflexes and whatnot, okay? And then we also have complement, all right? More complement. Who doesn't want more complement? I love complements, okay? So complement here is another non-specific way that if there's any infectious agents or pathogens, especially bacteria, that we can combat it, okay? So, of course, the clotting proteins, we know what that does, all right? The kinins are great for pain reception, but also they're going to help out histamine, make the capillary more leaky. And it's going to increase our CAMs. So we can get more cells to marginate, so we can get more cells to undergo diapedesis and then move towards the area. That's positive feedback. That's nice. I like it. Okay? So bradykinin, that is one of the kinin classes that will involve pain. Okay? All right. More on plasma proteins here in a second, because you remember when we were talking about bulk flow, remember bulk flow, hydrostatic pressure, and oncotic or osmotic colloid pressure. Okay, that's going to factor into this in a moment. All right, this is where lymphatic vessels come into play. We'll see that in a second. Okay, so when we're talking about inflammation, one of the signs of inflammation is swelling. Swelling comes from fluid migration into the damaged area. Okay, so there's several different types, and I'll talk about the different types of issues here when we talked about inflammation. But there's redness, pain. We just saw what causes pain. All right, the fact that there's bradykinins there, pressure from the fluid that's going to build up there on nerve endings causing pain. All right, warmth. Have you ever felt an area that's inflamed? There's a little bit of heat there. All right, we just saw what causes that. All right, well, one of the things, the pyrogens from the macrophages, but also, okay, increased metabolic function in that area because the cells are now trying to repair damaged tissue. Lots happening there. Anyways, I'm jumping all over the place. Sorry. So, fluid, swelling, all right, is referred to as exudate. All right, exudate is basically pus. All right, remember I said this situation, inflammation, immune response is war. You're going to have dead soldiers. That's what pus is. All right, it is the leftover remains of a lot of white blood cells, unfortunately, some other tissues that are involved. So we have a lot of protein in exudate. Okay. So with our fluid infiltration into the area, all right, because it's a result of the blood vessels vasodilating and become more leaky, all right, we're going to see that increase in capillary permeability. Part of the problem when a capillary becomes leaky, all right, is that we're going to lose some of the contents of our blood. All right, we talked about the cells. Now we're going to see, all right, in our plasma, we are going to lose some of our proteins. What does that mean? All right, remember bulk flow is a push-pull. Push is the hydrostatic pressure, and the pull is going to be the osmotic colloid pressure, right? That's like the attractiveness that proteins have for water and fluid, okay? Well, guess what? If we're losing our proteins, if they're pouring or leaking out of our blood into the tissue, all right, now the osmotic or oncotic pressure inside that blood vessel has decreased, all right? It has less pull, okay? So therefore, it's not going to be able to reabsorb, all right, as much fluid. So that fluid stays into the tissue because we've decreased that capillary osmotic pressure, thereby decreasing fluid reabsorption into the blood. So it stays in the tissue. Oh man, that sucks. Nuh-uh. Not really, because we have this process called washing. Remember, capillaries, all right, are found in between a venule and an arteriole, but there's another structure there too. Are lymphatic capillaries, okay? The lymphatic capillaries are also in that vicinity. So as the tissue pressure increases, the tissue fluid pressure increases, all right? The capillaries for our lymphatic vessels, the lymphatic capillaries, will then absorb that tissue fluid, all right, because it's increased. I'll show you here in a bit. I'm not explaining myself very well. All right. So keep in mind, the more fluid that builds up into our tissue, all right, it will be drained by the capillaries. I'll show you here in a second. That phenomenon is called washing. Okay. All right. So 72 hours is the acute inflammatory response. Okay. After that, it will start to slow down. Okay. We'll have fewer cells migrating to the area, fewer chemicals being released, okay? So at this point, the macrophages, all right, have engulfed pretty much a lot of the damaged tissue, and they've engulfed a lot of bacteria. Okay, we're going to have our dead soldiers here, the neutrophils here. All right, at this point, if you remember from chapter 6, all right, now we get the infiltration of fibroblasts, because our fibroblasts make the collagen tissue, which are going to make the collagen fibers there. Scar tissue. So fibroblasts infiltrate into the area, and they start laying down collagen tissue to repair that damaged tissue in the area. Okay? So I've been waiting to get to this picture here. The inflammation picture. So let me just run through the story here just a little bit. Okay, so you can see, here's our kid, skateboarder, typical. Fell off, skinned their knee, and they have these abrasions here, okay, and some cuts into the skin. Unfortunately, some pathogens have infiltrated that area, okay? In this case, it's bacteria, okay? From the looks of it, it looks like it's gram-negative rods, okay? I'm just kidding. Not that I made that up, but they are rod-like, so I don't know if they're gram-positive or gram-negative. Is anyone here taking microbiology? Okay, so you know what I'm talking about, gram-negative. All right, I know. You want to forget it. I know. Make it go away. All right, anyways. Damn you, Gram Stain. All right. It's a microbiology joke, sorry. Nerds. No, okay. Here we go. So you can see here's the issue. Here's our stimulus. Here's our problem. So we've damaged tissue. Okay, so the first part, okay, we have inflammation occurring. Okay, so we have these chemotactic and these chemicals being released from the site of injury. Okay, so we have mast cells that live in that tissue. So they're going to start to release histamine, all right, and heparin. Okay, so our mast cells start to release the histamine and the heparin, and also those chemotactic agents. Okay, so that's from the tissue. So that is going to cause, all right, this blood vessel to become more permeable and leaky, all right, cause it to vasodilate, causing more blood to flow into the area, all right, and it's going to prevent it from clotting, okay, because remember, now when we start to mess with, all right, the vascular wall, we're messing with prostaglandins. Remember, the prostaglandins keep the cells from sticking to the blood vessel wall. It keeps it, yes?
So does the amount of heparin actually like recede throughout the process?
Oh yeah, it will. Yeah, yes, absolutely, yep. So now what happens, okay, we start to get basophils to migrate to the areas. They're flowing through the blood, okay? So they're doing their thing. They're releasing the same chemicals, okay? So now, go to stage 2, vasodilation, okay? We're making the blood vessels more leaky, and now we're going to start to get the formation of our cell adhesion molecules. Okay, we got to pull these cells in to the site of injury. Okay, so we're making our little arms here. Okay, and what will happen is those cell adhesion molecules will catch on, all right, to our neutrophils. The neutrophils will tumble against the margin of the blood vessel wall, but eventually it'll stop, and it'll stop near a gap. Okay, and what will happen is it'll squeeze itself through. Okay, so this is the recruitment part. We get margination, diapedesis, where they squeeze through, and then that chemotaxis from all those chemotactic chemicals that were released. All right, remember what I said. What's releasing those chemotactic chemicals? Well, the mast cells and the basophils, but also dead and dying cells, macrophages will, this bacteria here will. All right, so they're releasing their chemotactic agents. So now these cells will when I say quickly, will directly migrate right to that area, and they'll go to work. Neutrophils are usually the first ones on site. One, because they're the most abundant leukocyte in the bloodstream. All right, so there's a lot of them. So they go in there and they just start eating things up. They go after the bacteria here. Boom, 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 gobbling it up. All right, macrophages will be there too. They'll gobble up bacteria. They'll also go after damaged tissue too, okay? So this is all going on. Now, all right, as a result of our leaky blood vessel, plasma proteins leak out into the tissue. Well, guess what? Now they're taking their colloid or their oncotic pressure with them. So they're leaking out. So it's less likely for fluid to get reabsorbed into the blood vessel. No, that doesn't happen. What happens is fluid leaks out. And that causes that swelling. Okay? But as we increase our pressure in this area here, we have a low pressure in our lymphatic vessel here. Okay? And I know we briefly talked about it. Was it last class? Yeah. Anyways. All right. Lymphatic capillaries have valves in them, but also, all right, they have these valves that allow fluid to only go in one direction, and that's in. But because the fluid is higher outside the lymphatic vessel, all right, and it's lower inside, where's it going to go? It's going to go in. Hence the term washing. Okay? So the fluid will pretty much wash across the tissue and into that lymphatic vessel. Okay? So it keeps things in motion. Clears debris out. Clears the junk out of the area there. Okay? All right. That's a lot for inflammation. I know. It's brain filling. Brain filling. All right. I mentioned this before. I do want to just kind of throw this out at you. All right. When we talk about the signs of inflammation. Okay? And you know all this. What I mean is observationally, you know it. All right? You've gotten something that got infected, I'm sure. All right? One of the things you see is redness. All right? That's what happens when we increase the blood flow to the area because of all those chemicals that are being released. All right? That histamine, okay? And the heparin, we're increasing our flow. All right? The heat, all right, not only is because from the blood flow increase, because remember, blood is 1 degree warmer, all right, than our normal body temperature, but because think of all the cells that are going to work in that area there. Okay? It gets hot. All right, because the metabolism of all those tissues and cells has increased. So that gives us the heat. Swelling, increased fluid. All right, pain, because some of those chemicals that are released into that area are irritants to what we call free nerve endings, a special type of receptor. And the free nerve endings will do what they do when they're stimulated. They will send pain sensation to the central nervous system. And that's what happens here. We got our chemical irritants from the kinins, the bradykinins and whatnot, all these different chemical messengers. Not only that, from the physical compression, all right, of that fluid that's infiltrated into that area there. Okay, so that will irritate those nerve endings there. And then, depending on how extensive the damage is, we can have a loss of function. All right, it can be temporary or permanent. Hopefully it's temporary. And that's usually because of the amount of swelling that occurs there. But if there's a lot of scar tissue formation, okay, remember, again, chapter 6, when we talked about fibrosis. All right, fibrosis is scar tissue formation, and then there's regeneration. Hopefully it undergoes regeneration where we restore the normal organ function. But if there's excessive scar tissue, then you will lose function. And that, hopefully, when we have loss of function, it'll only be temporary. If it's permanent, then we're dealing with a more severe type of situation there, okay? So again, acute inflammation does not last long. Less than 2 weeks, okay? Right? But if it's chronic, bad. Chronic inflammation, bad. Yep. All right, yes, I want to jump into fever real quick. Sorry, we have a few more minutes. All right, fever, okay? I like fever. Yes, I do. I like fever. How about you? All right, we should all like a proper fever. In fact, you know, they even said if you go and get the vaccination, all right, if you have a low-grade fever, do not take any anti-inflammatory or anti-pyogenic medication like Tylenol. Right? There's studies. We've talked about this, I believe. Yeah. Studies over in Australia where they have found that the efficacy of certain vaccinations decreases if you take an over-the-counter anti-inflammatory, anti-pain, anti-fever, or fever reducer. All right, it will impact the efficacy. They should have. You know, I'm really surprised about
I
that.
had a 103 fever for 2 days straight.
Did you take anything for
I
it?
absolutely did.
103 is different though.
Yeah, it was
But
so
if
bad.
it's, yes, well, what they should be doing is telling you, all right, if you have 100 or 101, okay, try to deal with it.
They
But
told me you're gonna have aches and pains.
yeah.
Take time my life broken. I said, okay.
Yeah. Yeah, 103 though, that's when you're starting to creep into some issues, and that's not a problem. But if it's low grade, you know, where it's not where you're feeling like crap, I would definitely try to withstand from that. All right, so we know our normal body temperature is 37 degrees Celsius or 98.6. 98.6 Fahrenheit. Okay. All right. So we will see. All right, certain chemical markers, all right, specifically interleukin-1 here is an example of a pyrogen. All right, there's several others. I believe interleukin-6. I'm not sure if I think interleukin-10. Anyways, all right, these chemical messengers will stimulate, all right, the hypothalamus, all right, to increase your body temperature. So we call these pyrogens, all right, and they can come from, all right, damaged cells, infectious agents, or your immune cells here. And what will happen, the end goal is to get these pyrogens to this guy, hypothalamus. Okay, the hypothalamus controls your body temperature. All right, and as a result, when it releases, all right, the eicosanoid, the prostaglandin E, all right, it causes an increase in your body temperature. Okay, there's 3 stages to it: onset, stadium, and deferescence. Okay, let's talk about each of these here. Onset, easy. Your body temperature starts to rise. Why? All right, we start to get, all right, constriction of the blood vessels in your skin. Remember, that's one of the ways that your body cools itself off. If your body temperature increases, it causes vasodilation to the blood vessels in your skin, so you can release the heat. Well, in this situation, all right, the hypothalamus causes vasoconstriction, and it keeps the blood from flowing to the skin to give off the heat. A lot of times it'll shunt the blood more towards the internal structures there. In certain situations, and I'd like to think that most of us have experienced this, all right, you get shivering. Have you ever had a really bad fever? All right, you just can't get warm and you're shivering, and it could be 98 degrees outside, it doesn't matter. You're freezing, all right? But that is part of the reflexive process. When you shiver and the muscles start to generate heat, it's because that friction that they're causing from that process of shivering generates heat to increase, all right? So we will describe it as chills. I got the chills, all right? You feel cold, but you're not, because then someone will touch your forehead and be like, oh man, you're burning up. Well, no crap, I'm burning up, man, because my body's shaking. All right, so a certain point here, all right, we start to increase the body temperature, okay, and then it starts to plateau out. That's why I think the second event here should be called plateau, but they call it stadium. All right, so this is where we just maintain that temperature. Because why? We've turned up our metabolic rate in our cells. They're going gangbusters. All right, and metabolic rate is metabolism is just basically chemical processes. There's 2 types. It's either catabolic or anabolic. You're making stuff or you're breaking stuff down. That's essentially metabolism. But those are chemical processes. And one of the byproducts, if this is going into chemistry, of chemical processes is heat. Okay? We call those exothermic reactions. They give off heat. All right? So that's what happens here. As our metabolism increases, all right, we start to give off heat as a byproduct. All right? But that is because we're getting rid of bad things. Bacteria, virus, whatever. Certain bacteria can only live, for example, at a specific temperature. And that's the nice thing about a fever. You turn up the dial just a little bit, it can kill off a significant number of bacteria. Now, there's bacteria out there, and you guys that took micro may have heard, that can live in the volcano, can live in the center of the earth. And there's a thermophilic, I believe is what they're called. It's this classification of bacteria. That's how badass these bacteria are, all right? So they can live at that, but a lot that we encounter, all right, can't sustain, all right, normal functioning of life-sustaining processes if we turn the temperature up on them. So fever is a good way to kill off a whole bunch. During that time too, our liver and spleen will become stingy with iron and zinc, because guess what? A lot of microbial organisms need zinc and iron, all right, to reproduce. Go figure. I know. And have you ever heard of the restaurant Iron Hill? Well, I'll tell you in the break. I don't want this to be recorded. all right. The last event of fever. All right. This is when we go back to normal. This is when we bring our body temperature back down. Okay. So now the hypothalamus is no longer going to be stimulated by those pyrogens, so it will stop releasing the prostaglandin E2. Okay. And so we no longer are producing the prostaglandin. All right, and so therefore the hypothalamus causes the blood vessels in the skin to vasodilate again, so we can shunt more blood to the surface of the skin and your to give off the heat, and your muscles stop shivering. And we can invoke sweating. Last part, nope, I'm going to stop here. I've gone over. All right, good job though, y'all. All right, let's take a break here. I'm going to stop recording because it's going to crash on me anyways. If you have any questions, ask me in lab.